Last year, our Board of Trustees, very thankfully, has set aside $200 million to support efforts to help do what is needed in rural Georgia. Part of this will be funding in 23, starting with 10 pediatrician scholarships that will fund students who want to be pediatricians who make a commitment to go back and practice in rural Georgia. And I get so excited about thinking about 10, 10, 10, 10. I mean, over a period of time, we could really help solve the issue that there are, I think, over 60 counties in Georgia that don't have a pediatrician. Children's actually has the most pediatric emergency visits of any other children's hospital in the United States. And so we're going to offer and use that expertise to work with some of the rural hospitals who get kids. We want to make sure that there's the right equipment, the right training, and that we are using whatever expertise we have to have kid-ready emergency departments all across our state. We live for kids, we love Georgia's children, and we could not be prouder to be working with Mercer, with Dr. Sumner, with Dr. Tarbutton, with Glenda, with the phenomenal people that we've been able to meet. And we just can't wait to see what kind of impact we're going to be able to have together.
Children's is a treasure. You may not know that, but I want to encourage every one of you to figure out who Children's is and what they do. They do it better than anybody, and they do it well. But they are the experts in the specialty care of children, and certainly they do general pediatrics. This initiative is made possible through their desire to help all of Georgia more than they're helping all of Georgia. They're already helping, but this will help us all. We want to build confidence in the local community of the ability of their rural hospitals and build the skill of those physicians in the emergency room. In 10 years, I want you to look back and realize that this initiative is a foundational change in Georgia. We're going to bring everybody together for the good of children. We don't give up, we keep at it, but it wouldn't be possible without this institution and the affiliation that we've been able to grow.
There's nothing more important than our children. We'd do anything for them. Certainly we want them to have access to the best health care possible. And that's true regardless of where you live. And I think this initiative today is all about ensuring that our children have access to quality health care regardless of their zip code.
It means that we will have, as pediatricians, extra educational opportunities to stay current with best practices in pediatrics. It means hopefully we will have telemedicine availability from some of the top specialists that are available at Children's for our children in rural communities who don't have the ability always to drive to Atlanta for that care. It means that hopefully we will have programming that, for instance, may be able to help assess mental health and provide access to psychiatrists and counselors that our children in rural areas need so desperately.